You might have seen me briefly in the other room when I came by and waved. I was moderating the chat before, but yeah, I'm Justin Colacino. So I'm an assistant professor in environmental sciences, and I'm the graduate chair of our program. And so my job is to really like run and manage both the MS and PhD programs. And so here I don't have any slides or anything, but I'm here to tell you about how our program works and then answer any questions that you might have about sort of like logistics or what research like is what research is like at the University of Michigan. And so maybe I'll just tell you a little bit about myself and my journey because I did my graduate work at the University of Michigan, so I can speak to the sort of like the joy of being a graduate student here. So I did my bachelor's degree in biochemistry at the University of Texas, and then I spent 2 years as a research assistant in ovarian cancer at MD Anderson Cancer Center. Before I got my own MPH degree at the University of Texas School of Public Health at UT Southwestern, where we were studying chemical contamination of the US food supply. And so I did a master's thesis project where my job was literally to go around all these grocery stores in Dallas and buy food, and then we would ship them off to our chemist colleagues all around the world, and they would measure chemical contamination in our food supply. And so we found out that our food supply is contaminated with all of these different chemicals, like flame retardants and plasticizers and PCBs, pesticides, and this like understanding these like big mixtures of chemicals and their health effects really was what brought me to the field of environmental sciences. So I did my PhD here at the University of Michigan in the School of Public Health, and then afterwards I joined the faculty. And so my lab studies breast cancer, and so I can speak to how great of an environment the University of Michigan is to do a graduate degree. And so you heard about how we have our MPH program, the Master of Public Health, and our MS program, the Master of Science. And the Master of Science degree is really a science-based program. You'll take some coursework that will give you some basics in public health, give you some basics in environmental sciences, give you some basics in biostatistics and data science. But really what drives this field and what this degree is about is research. And so usually what the logistics of this degree look like is that you would come in the fall. So you come in like late August, you'd enroll in classes. But that first semester, you're going to be really looking for that like right research mentor match. And so you heard about all of the faculty we have in our department. So there's a lot of flexibility in projects here. So we're talking about different, like learning about exposure science, learning about occupational or environmental epidemiology, learning about toxicology, and you're going to really be like working in a lab. So that first semester, you want to start to send out feelers, and this is part of my job is to help you get set up with the best faculty mentor possible. That second semester, we want you to start to be in the lab working with your mentor, maybe working with other folks in the lab, other students, maybe PhD students, postdocs, research scientists, to develop a project. We want you to write up a project proposal. So, 10, 12 pages of background about the project, and then pitch it to your committee. And so your MS thesis committee will consist of your mentor, another faculty member, and then a third committee member who could be a faculty member, could be an interested community member, could be a postdoctoral fellow that's working with you on this project. And so you'll talk to your committee about your research. They'll give you feedback, and should everything go swimmingly, which it usually does, you just jump into your research. And usually what we're thinking is for the summer is when you're going to get the bulk of your research done, because you have really like full time to work then. No classes here over the summertime. And so you'll be working in the lab, doing wet lab research. You might be doing sort of data analysis, research on an existing data set. You might be going out and collecting environmental samples. You actually might be going around the world and doing research with some of our international collaborators. You'll be collecting data. You'll be doing the research that you proposed. And then in general, you'll be coming back in the fall, you'll be like wrapping up your research, you'll be doing data analysis, with the idea being that in the winter semester, so that's sort of like the fourth semester of your second year, you'll be writing up your thesis and defending your thesis. And that's like the structure of the master's degree. Ideally, you're being trained in rigorous scientific methodology. You're learning all about environmental sciences, the different fields of environmental sciences, with the goal being that you will then be able to go out and really do independent research. And so, Leah, you asked who are a few of our your international collaborators. So I can answer from my end first. So we do work with um, predominantly folks in Thailand. So I have a collaboration with Goet Namboonmi, who's at Mae Fah Luang University in northwest Thailand, in an area of Thailand that's near the border of Myanmar and Laos, called Chiang Rai. It's a beautiful place in the hills of Thailand. And Goet is both a toxicologist and an occupational health expert by training. And so we have a collaboration with Goet where we're trying to understand sort of like health risks of farmers in northern Thailand from pesticide exposure because of where Chiang Rai is located in northern Thailand. They have a lot of migrant farm workers that are coming over from Myanmar. Thailand has a much better economy than Myanmar. The economic opportunities are much better. So there's a lot of farmers that come in from Myanmar, that come in from Laos to work in Thailand. And so we were concerned, along with the farm workers and along with Goet, that these farm workers might be highly exposed to pesticides. So we have an ongoing study of farm workers and potential health risks from pesticide exposure there. I have another collaboration that I'm starting, getting off the ground this last year or so with some folks at the All India Institute of Medical Sciences in New Delhi, India. And so this is really one of the best hospital systems in the entire country of India, some real leaders there. And so what we're doing there is trying to understand breast cancer in the Indian population. And so we have an ongoing study there where we're getting tumors in from Indian breast cancer patients. My lab is really excited and interested in breast cancer in the environment, and we're trying to really understand what's the biology of Indian breast cancers, because we really don't know. Most of our knowledge about breast cancers has been generated in people of European ancestry, and so almost all the information we know about cancer biology is based on people from European ancestry. But we know that everybody is different. People's exposures are different. India has like highly increasing rates of breast cancer, and so it's really important to understand this. And so our faculty members have diverse global health collaborations in Africa and in South America, in Europe, in Asia. I think this is a real strength of our program. Let's see. So Claire, you asked, is there an option to receive a dual degree in global health science? Or just pursue a concentration in global health. As far as I know, I don't think our university offers a degree in global health science per se. So usually you'll be doing a concentration in global health with this like real focus on global health internships and research. So we have specific classes in the school that focus on environmental health and public health from a global perspective. So you would be taking those classes, as far as I know. And so, yeah, so I'm happy to answer any questions you guys might have about the master's program. Yeah, it's a great program. So I've had the opportunity to directly mentor 5 MS students in my lab, and then I've been on committees probably for another 8 or 9 MS students. So I've seen people come through the MS program in our department. I've worked with folks in nutrition, where I have a joint appointment, and it's a very successful program. It's really neat to see students come in and then really be able to pick up all the science, develop all these skills in the lab, and then like generate new knowledge in the areas of environmental health sciences. There's like a lot of problems in environmental health sciences. We need all of you smart people to help us out. Yeah, so I'm happy to sit here as long as we want and answer questions you might have about the program.
What does the process for actually finding a research lab, what does that actually look like? Is it more of a rotation of us going into different labs, or how does that work?
Yeah, so that's a great question. So in case you couldn't hear, the question was about what's the process of finding a research lab. And so that's part of my job as the graduate coordinator or the graduate chair, is to help you set up these connections with faculty that you might be interested in. Of course, if you've gone through the EHS website and you've been looking at the faculty web pages and you've been reading papers about faculty you're interested in, I would strongly encourage you just to email those faculty. we're always excited about connecting with potential students. But when you get here, your faculty advisor, who you're assigned, doesn't necessarily need to be your research mentor, but your faculty advisor can help you navigate this. And I can also help you navigate this. I think the advantage of our department is it's not super big, so it's not hard for us to make sure that every student is getting that sort of like personal touch, especially in the MS program. So the MS program, we currently have 12 students, so it's easy for me and easy for the other faculty to make sure that you guys are getting placed in the best opportunities possible. And so Leah asks, what sort of relationship or collaboration does the program have with the medical school? Oh, is there an option to extend it into an MD PhD with the PhD component remaining within the EHS realm? So yeah, so Leah, this is a great question. So I think a number of us have very close collaborations with the medical school. For instance, I have an appointment in the medical school through computational medicine and bioinformatics. So a lot of us are like very tightly engaging with our colleagues in the medical school. Especially those of us who are more on like the wet lab side. So like I'm a breast cancer person, I interface very closely with folks at the cancer center. And so you ask about this opportunity to extend into an MD PhD program. And yes, this is a possibility. We have had students that do this. And so Michigan has a very, very good MD PhD program. They call it the MSTP program. It has its own training grant. And of course, Michigan has quite a good medical school. And so the idea would be if you do, so like say you really enjoy research, you like what you've been doing, you've started off on a project, you completed a successful master's thesis, but you really want to continue on to the PhD. Medical school, and then you'll come back for your PhD, and then you will and that will take somewhere between 3 to 5 years. If you've already done an MS in the department, usually you'll be closer on the 3-year side. And then once you complete your PhD, then you go back to medical school for those next 2 years. And so we have had students that will do this throughout public health. So I know of students that have done this in EHS. I know students that are currently doing this in epidemiology. So this is a pretty common thing. And I personally love when doctors get training in public health and environmental health sciences, because I think you guys are seeing it now, right? Prevention is key. The best public health is invisible. It's like the stuff, when things are going great, that's when public health is doing its job, right? And so that's why it's so important, I think, for physicians to be trained in these concepts of epidemiology, public health, environmental health sciences, and the MD PhD program. Doing a PhD within EHS would be a perfect opportunity for that. So that's a great question, Leah. Thank you. Yeah, so I'm happy to answer as many questions as you guys have. If after this session, there's like a question that comes to mind, feel free to email me. I'm going to drop my email in the chat box. And so I can tell you all of the nitty gritty about graduate school at Michigan. I can tell you about like life in Ann Arbor, like why this is a really nice place to live. So like the faculty environment, the school environment here. We had the opportunity to go to other places for faculty jobs. I really love the University of Michigan. It's such a collaborative place. It was just the resources here are amazing. So I thought that this was just the right place for me to spend the rest of my career. I think it's great. So I just dropped my email in the chat box. Please feel free to email me any questions that you might have about the MS program. Oh yeah, so Leah, so you're talking about the relationship between climate change and human health. So this is obviously a really hot area right now. One of the cool things about the University of Michigan is that there's this presidential initiative called the Biosciences Institute. And so the idea is that the university is pumping $100 million into building up all of these programs in important areas of biology. And one of these areas that was chosen for one of these large projects is understanding what they call global change biology. And so this is like an area where there's been a huge cash infusion at the university level to really build up our understanding of climate change and human health. There's a couple of faculty members who I would strongly encourage you specifically to reach out to. Marie O'Neill is in our department. and is joint with environmental. So she's joint in environmental health sciences and in epidemiology. So she's an expert in climate change and human health. And then another faculty member, Karina Grumlin, who is in the Institute for Social Research, and I can like link her. I can link her profile here in a second. She's another expert on climate change and human health. So this is, I mean, this is a super important area, right? And this is also a huge focus here at U of M. Let me like pull up her profile really quick.
There's Marie.
Got Marie? Yeah, and so Karina did her PhD in our department, and now she's working in the Institute for Social Research, which is on the other side of campus. But they have some really exciting projects going on in this area. And then there's a lot of great opportunities for collaboration with the School of Environment and Sustainability. So I have an appointment over in the program of the environment as well. So of course, there's much interest in this extremely important topic on campus. Yeah, so this is fantastic. So if any of you you're like thinking you have any questions, I am for sure happy to Skype meet with any of you, Blue Jeans, phone call, email. If you do have questions about the program, we are excited about having you guys here in Ann Arbor in person in the fall. I would encourage you if you have any questions to reach out.
I'm going to post the link for findings if you want to tell the person who asked about climate change and what the issues on the way.
Oh, sure. Yeah. And so, Brian, who's helping me out here, is going to post a link for findings, which is our SPH magazine, which is quite cool. There it is. Oh, under Michael's name. And so the most recent issue of this is on climate change. And so, of course, this is extremely important across the university. Well, great. With that, unless anybody has any last minute questions, I'd like to really thank you all for attending our virtual session. Apologies that you couldn't be here in Ann Arbor, but this is the right thing to do for public health, is hold this virtually. And I was happy that we got to see such a great turnout. Again, if you have any questions at all, feel free to email me. I'm happy to take a phone call or email or Blue Jeans with you. Otherwise, do not hesitate to reach out to other faculty members in our department. And I hope that you all have a nice, relaxing weekend. Stay safe out there. Good for public health. Great to talk to you.